background there. Wonderful. He regards himself as a lifelong learner whose hobby is magic. Mr. Hunt enjoys sharing the knowledge gathered by the AARP and sprinkling his live presentations with a little magic and humor, which I'll tell you, we can all use right about now. So thank you so much. And we're really looking forward to the presentation today. And I'll just reiterate what our presenter David said, that please feel free. He's very happy to have you ask questions as we go. So if you do have a question, just go ahead and unmute yourself and ask, or go ahead and put it in the chat, and Miss Ginny will keep track of the chat. So welcome.
Take it away.
Well, thank you. I'm glad everybody's here with us. At the end of the presentation, I will put on the screen again some website addresses for you to take note of along the way. And that's why I asked you to come with a pen and some note paper, because this kind of presentation, we're not going to show everything, but I'm going to show you where to go to get it. So let's get started. When it comes to caring for a loved one, most families don't have a plan until a problem or a crisis exists or emerges. Now, more than ever, it is important to prepare for the future, as we now expect to live 20 to 30 years beyond the traditional retirement age of 65. In our session today, you'll learn the 5 steps to create a caregiving plan. You'll learn how to connect with other family caregivers to share tips and information. And you'll learn about some resources available to you. So let's get started. One of the main pieces of information we have for you is the Prepare to Care guide, and it's available online at aarp.org/caregiving. If this was a face-to-face presentation, I would give you a copy of this. But I know when you tell people, or when people tell me, just go to the website, you can find it easily, that increases your stress level because you don't know how friendly it is. So I'm going to try to reduce your stress level here. If you go to your web browser and you type in aarp.org/caregiving, this is what you'll see. Now at the top, you'll see here, this is what I typed in. I circled it up here. And then you'll go over to the search icon here. And when you click on a search icon, this is what you'll see. You'll get a little window in here, and you can type in Prepare to Care. Now, like many things, when you type something in, this starts to populate in here. But don't worry about that. That's not what we're concerned with. Just type in Prepare to Care. Click Enter. And this is what you'll see next. So you go to our website, and then you can download the Prepare to Care guide, which it has a lot of information in it, what we'll talk about today, and much more. Once you're at this page, if you scroll down further a little bit, there is a space that's easy enough where you can actually order a hard copy, and we'll mail it to you. There's no charge to it. So you can either download it, or you can ask to have a hard copy mailed to you. The next thing we're going to recommend that you take a look at is a little video, and it's Stories of Jazz and Caregiving. Stepping Up is what it's called, and it's lovingly opens a door to the lives of 4 musicians and their families as they struggle to balance the roles of artist, caregiver, patient. This film story brings to light the challenges that many face, while at the same time offering support on how to meet the roles and demands. So, this word artist we have in here, you could substitute plumber, teacher, virtually anything, because the role of a caregiver, you're going to find similar challenges for everybody. So, to see this short film that showcases the powerful and emotional stories of an African-American family as caregivers, again, you would go to videos.aarp.org and you would insert Stepping Up. So again, let me show you what you'll see. If you type into your browser videos, aarp.org, it'll take you to this page. And you can see at the top, that's what I typed in. And the pop-up, the search window is here. The search window is here on this page. So when you click on the search window and you type in Stepping Up, and then you click enter, it'll take you to this page, and here you can access the video. You can play the video from here. It's 17 minutes, and it's really a good story. It's worth going to see. Okay, we're going to talk briefly about some of the things that caregivers have to juggle. So let me give you a few of the things to consider. First of all, we provide services for household tasks, cleaning, laundry, yard work. We pay the bills for people. Emotional, spiritual support and companionship, which is a big piece to being a caregiver. We buy food for them. We cook meals or supply cooked meals. We run errands and driving our folks to different kinds of appointments. We help with their medications, personal care, bathing, dressing, etc. And communicating with health professionals and coordinating care. These are just a few of the things that a caregiver does. And these words, I think, are as powerful as they were when she wrote these many, many years ago. It is only in the giving of oneself to others that we truly live. The human contribution is the essential ingredient. And if you have a loved one who's shut in at home or in a nursing home, they really do look forward to your visits and conversations. So. Okay, here we're going to try our activity. Try to find, you'll find your 8 pennies or coins, and if you don't have any, I would ask you just to pretend, because I know you pretend with your grandchildren, so you can pretend here too. So what we're going to do is, for every task that I read, balance 1 coin on your middle finger. Okay, is everybody ready? Let's. Okay, take mom and dad for a medical appointment. Balance 1 coin on your finger. Pick up a prescription. Put a 2nd coin on your finger. Organize and help ensure mom takes her medications. Put a 3rd coin on there. Call the insurance company. Put a 4th coin on your finger. Shop for the groceries. Get the 5th coin there. Cook meals. Balance a 6th coin. How you doing? My guess, you got coins on the table and some on the floor right now. And we haven't even considered this. You have to mow mom's lawn. You have to do laundry and clean mom's house. Bathe and dress mom. You have to go to work. You got to pick the kids up from soccer. You got to pay some bills and take mom to the beauty shop. This little activity we did is to show you that you really can't do it by yourself. You need to have a team, and that's the best approach to be using. So you can see how difficult it can be to balance all of these things by yourself. I want to share with you a few facts about caregiving as a background. Family caregivers provide the majority of long-term care in the U.S., and the average family caregiver is a 49-year-old woman who works 35 hours a week and provides almost 25 hours of care per week. Think about that. You work 35 hours and you spend another 25 hours providing care, and you need to have some time for your family in there too. More than 42 million family caregivers each year provide care for aging parents, spouses, aunts, uncles, friends, and other loved ones. Caregiving affects the whole family. And men are now almost as likely to say they are family caregivers as women. 40% are men, 60% are women. And today, 24% of the younger Americans aged 18 to 34 say that they are family caregivers. The age of family caregivers is coming down. And and this is why we think is that our parents and their parents, they were having children at age 20. That's around the time that they had their children, 18 to 20 years of age. So when they retired at 65, their kids were what, 45? But today, the average person now is they're 30 to 35 years old when they're having their children. So when I reach 65, my kids are going to be another 10, 15 years younger than that was the case for my parents. So the age is reducing. Okay, are you prepared to be a caregiver? The 5 steps to creating a plan. I'm going to touch on the 5 steps here, and then we'll go back in and look at each step individually. The first one is to start a conversation, form your team, make a plan, find support, and care for yourself. And here I'll remind you again that when you do go get your copy of the care guide, you will see all of this information in the care guide and more. Starting the conversation. This is usually, most people put this off because we avoid these discussions because these discussions usually lead to change in the lifestyle of your parents, if that's the person you're providing care for, or yourself. So we kind of avoid those things. But to help you look for an opening, if you're having this conversation with parents or such, you can say something like, well, I saw an article in the newspaper the other day, and it talked about estate planning. And I was wondering what kind of shape you're in, Dad. Can we talk about that? You can say you saw an article in the newspaper or on the news that had to do with care and the cost of medications and Medicare going up as people get older. So it gives you an opportunity to start the conversation. Now, during this initial conversation, it is important to respect your loved one's wishes and try not to go into this conversation with preconceived ideas of what you think should happen and to help them out. You want to hear what they have to say. And during that conversation, at the end, size up the situation. Are they being realistic? If you're talking with someone who has dementia, that's a whole different kind of conversation than you are with a person who's functioning fine, but they have physical limitations now. And this is one big part of the conversation, talking about finances, because money is often at the heart of these decisions. What kind of finances do you have to pay for moving into a 50-plus community or moving into a nursing home? And does that nursing home, is it the type of nursing home where you have sort of an apartment and you cook your own meals? Or is it one that they have a dining hall at? Is it the kind of place there where somebody comes to your room every night and makes sure you take your pills, or the kind of place where you have to remember to take your pills? So finances affect many decisions. So you do have to talk about bank accounts, investments, insurance coverage, and other finances and assets or income. Now, I would kind of expect to encounter some resistance, because people, they just don't want to talk about it. And if that's the case, keep in mind that some people are private by nature. Sometimes it's difficult for someone to admit they need help, and as a result, you may encounter some resistance. If your first conversation doesn't go well, try again. But if you're still running into difficulties, try asking a trusted family friend, a doctor, a faith leader to share your concerns. Okay, step 2, forming your team. We want to look for some suggestions. We want to look for some people who live nearby. And I'm going to put a little caveat in here for living nearby. It depends upon the duties or the responsibilities you're going to take on in the plan. If it is you're agreeing to go over and do the laundry for a person every week or every couple of weeks, it would be important that you live nearby. But if you're assigned the duties of, say, making medical appointments and transportation, well, it's not all that important that you live nearby for this, because you're not going to go to the doctor's office. You're not, you're going to make a phone call. So whether you make a phone call from around the corner or from 3 states away, it really doesn't matter. So that's one thing to consider. And then can they help with simple tasks? If there's simple tasks you're looking for, you as the leader of this team, you can ask people to do some things. Can you do this for Uncle Joe? And we would like to have someone stop by at least once a week and have it just talk with them for a half hour. Can you do that? And people will say yes. They may not think of it on their own, but they will say yes if you ask them. And ask people to share their talents. In this, I mean, let's say you have, you're pretty good at numbers and finances, and your dad or mother or someone needs someone to balance the checkbook each week. Well, then you're more inclined to share that talent that, yeah, sure, I'll balance their checkbook. If you're the person who enjoys working out in the yard, in the garden, well, then you may volunteer to take care of the flower beds and cut the grass at that person's house. So look for the talents that people have and ask them to share those. Determine the number of team members. And here it's not just the number, but it's the quality, the quantity and quality here. You're looking for people who will commit and will actually do what they say they will. So for all team members, you want to assign roles and responsibilities. And it's important here to focus on the recipient, not so much what you're going to do, but we're doing this to help out Dad. We're doing this to help out Uncle Joe. And if you focus on the recipient, you really don't mind doing things. Okay, then the next thing we want to do is we want to hold our step 3 is we want to hold a team meeting and meet with your caregiving team. Now, of course, a face-to-face meeting is best, but a lot of times you have to do these over the phone because the family members or people providing care are in different states. Myself included, I provide care for a sister-in-law in Alabama. And I prefer too when you're having a meeting, when you can't do it face to face. I think a stream of emails is better because then you have a record of who said what and who committed to what. So you want to assess the goals and the needs of the plan. What do we really need to do for this person? What help do they need? And then again, delegate responsibilities. That's kind of resonates through everything. Include the person who will receive the care. I believe this is important too. And I'll give you an example why. Let's say this person really does need somebody to balance a checkbook. And his oldest daughter says she'll do it. But your dad, would prefer that the younger son balance the checkbook and not the older daughter. So you need to hear you need to hear the kind of resistance people have when you're offering help. Keep everyone informed of the plan and take notes along the way. It's always a good idea to have some notes. Step 4 is to find some support. If you've come to realize the scope of care needed for your loved one is beyond what you or your team can provide, it's okay to reach out for extra support. There are a number of ways you can obtain the help you need. So let's look at a few types of support. The first one is community resources. And when we're looking at the community resources, we're looking at many different things. It could be Meals on Wheels. It could be adult daycare. It could be a counselor. It could be a social group of people who are providing help to other people so that they can talk about their trials and tribulations. So we want to look at that. And then you may want to consult with a professional. And this might be a nurse. This might be a clergy. This might be a social worker. Those people are available to help us. And it's okay to hire help. By that, I mean, if you need somebody to come in and clean the house, do the house cleaning every couple of weeks, there's nothing wrong with that. So consider the kinds of tasks that you really do need to hire some help for. And a few more ideas. You want to secure their safety. And when I say secure their safety, I'm thinking of things like, is there enough lighting in the house? Are there rugs at the top of the steps or someplace that don't have that skid-free, the skid-free thing that goes underneath the carpet so it doesn't slide? Are there handbars in the shower? So you have to look at those ideas too. And AARP does offer a class called Home Fit, And it looks at your house and looks at all the issues that if you want to stay in your house as long as possible, this is a good class to take because it gives you ideas of what to look at to keep everybody safe in the house. And then you want to explore the housing options. And when we say housing options, we're talking about different kinds of nursing homes that offer various kinds of services. And again, in our guide that you're going to download or have sent to your house, you'll find a lot of information on this within the guide. And there are 6 questions that we recommend you ask if you're having when you're considering nursing homes today in the middle of the COVID-19. So let me share those questions with you now. Has anyone in the nursing home tested positive for COVID-19? You would want to know that. What is the nursing home doing to prevent infections? Does the nursing home staff have the personal protective equipment, the PPEs, like masks, face shields, gowns, gloves, that they need to stay safe and keep their patients safe? What is the nursing home doing to help residents stay connected with their families or loved ones during this time? What is the plan for a nursing home to communicate important information to both the residents and families on a regular basis? They should have a plan. And is the nursing home currently at full staffing levels for nurses, aides, and other workers? So those are 6 questions you should be asking when you're considering nursing home facilities. Another tip here is that if your loved one is in a nursing home, and if you're concerned about the safety and well-being of a spouse, parent, or other loved ones who lives in a nursing home, you can contact the ombudsman, and they will get you the information you need to know. I'm leaving this screen up just a moment longer in case you did want to copy down the phone number. And this is for people who already have loved ones in nursing homes. You'll find this number again in our guide. The last step is to take care of yourself. Don't overlook the impact of caregiving on you. Pay attention to your health and well-being. And some tips here are to tap into the resources that are around you. When we talk about the resources around you, there are social, again, there
This is Peggy Grella. You called me about my email.
There are workers and other people that we can talk with. The use of technology, not just the technology that you have for emergency kinds of things, but the different kinds of apps you'll find, or making sure you have a way you can do FaceTime on your telephone with a loved one. There are some technology issues that you can use to your favor. I know I'm hemming on those. We would ask you that you can always talk with your employer, see what kind of benefits you have at work, and let them know that you may have to leave work early a few times because you're providing help and caregiving for someone. And then you want to review your finances. And I know that sounds kind of silly, but it isn't. I mentioned earlier that I provide some services for a sister-in-law in Alabama. But one of the things that I do is I take care of transportation. So I call Uber and I set up the her rides to and from doctor's appointments and occasionally to Target. So, and then when you're doing with Uber, you put it on your credit card. So every month or so, if I remember, I total up the charges and then I pass it on to the other brother who's doing the finance part of her care, and he reimburses me. But there's many months that I just don't bother. So, you will end up spending some of your own resources. Some more tips: talk to your doctor to make sure that you're healthy enough. And then take advantage of the caregiving services and support. There are groups that you can talk to, sit down and talk with, usually now on Skype and those kinds of things, and talk to other people in the same situation as you. And then you'll find that some of the things that you've done that are ridiculous, they're doing the same thing. I can give you a short story here. My sister-in-law calls me and says, the Walmart called and said she has to pick up her medications. Well, we don't get her medications from Walmart. We get them from PillPack. So now I got to call a doctor to see if the medication was sent to the right place. And he said it was. And I called PillPack, and PillPack says, yeah, we got the information from the doctor and it's going out in their next mailing. Now I call Walmart and say, well, can you clarify what's going on? And it turned out the medication was for her husband, not her. But I'm making phone calls to everybody on an issue that it's kind of funny. So number 7 is to take a break. That means, spend some time, do exercise, get your own exercise, stay healthy, watch what you're eating, stay connected with your friends too, spend time with your family too. So you don't want to forget about those. So I'm going to talk about, we're rounding the bend here. If you're looking for some caregiving resource center, again, you're going to go to the AARP.org caregiving, and you'll see this. And another resource, which is really nice, again, from the AARP, is the Learn at 50 Plus. So if you go to our website, the AARP.org/Learn at 50 Plus, you'll find information like know your Social Security benefits, find your caregiving answers, learn something new. There's a whole bunch of classes under Learn Something New. And I think you'll actually find that quite enjoyable to go there. Okay, at this time, we're really right at the end of the presentation, and I'm going to leave this up on the screen for a little bit so that if you need to copy something, you can, and we can talk. Any questions that people have and would like to talk, this is a good time for it.
Yes. David, we had a question in the chat. It's a great question, actually. Are the AARP resources available to anyone, even if they're not a member of AARP?
Yes, they are. Yes, they are.
Thank you.
And we'd like you to spread that word too.
Well, some fantastic resources there.
Will these slides be available to us? Will they be something that we might be able to download?
No, not really.
Oh, poop.
But it sounds like the caregiving guide has this similar information in it that David covered. Is that right, David?
Yes, it has the information presented here, plus more. I mean, the resources. Okay. When I talked about community resources, I might have got a little tongue-tied, but there's a lot of information on the community resources in the guide.
And David, this is Jenny. You can either print the guide yourself, or AARP will mail a hard copy to you.
Yes.
Yes. Either way. Okay.
When you get to that page where I started the presentation, where you could download it. If you scroll down that same page, there's a spot there where you can order one, have it mailed to you. And there's no charge for that.
That's great.
Great. Yeah.
That
Well,
is wonderful.
there's
Thank you.
so much good, really good practical information.
Practical.
And I'd like to open it up now to some caregivers. I think we have a mixture on the call of some family caregivers and maybe some healthcare professionals as well. But I'd love to hear from some of the family caregivers to start with. Any either questions or comments or feedback that you have for David.
Or a story you'd like to share.
Yeah, that's nice.
Well, until somebody else jumps in, I'll just share that one thing that really resonated with me, David. One of the things you talked about early on was starting the conversation. And I think that can be really hard. And I had a personal experience with our mom when my folks were living in Florida, and it was time. They were just one crisis after another, and the 4 children were dropping everything all across the country and running down to Florida, and it came time to have the conversation about moving. And my mom really didn't. She said, "Oh, you can carry me out of here feet first. Why would I want to move? I'm not moving," and it was really, really, really hard to have the conversation. Well, after a while, and a little bit more sort of delving into the conversation, it turned out that it wasn't that she didn't want to move. She didn't want to be in a position to choose one child over 4 to live near. So, there was all this other stuff going on there that we just thought, oh, she doesn't want to move. She doesn't want to move. So sometimes I think just, there might be reasons why it can be hard to start a conversation. And sometimes you have to do a little digging and kind of get to the root of that before you can start that conversation. So once we kind of, got through that, we were able to start making some plans.
I want to share with you guys a quick little story that happened recently, which really sparked my interest in this presentation. I'd heard David do it, and I was like, well, what's going to happen? Well, shortly after I heard David do the presentation, my oldest brother had a massive heart attack and had to have triple bypass. He is the person who lives with my mom. My mom is almost 90. So now she's by herself. He was in the hospital for almost a month and a half or 2. So it prompted us to have to talk about how do we provide that care, not only for him when he comes home, but how are we going to provide care for my mom. So this whole presentation has really given me a lot of light on some things that we need to do as a family. There's 9 of us.
Okay.
Wow.
When my brother had that heart attack, we had 9 people trying to do 9 different things, provide 9 different ways of care. And it was a fiasco. So this whole presentation, I'm telling you, people need to hear it. It's important to start that conversation and to have a plan as to what you're going to do. You don't have to be 90 or 60 or 80. You can be 30 and your family have to provide care for you. And most of the time they are not prepared. We were not prepared for my brother's heart attack or prepared for what we would do if mom had to be by herself. So I appreciate this presentation. Thank you very much.
And just so everyone knows, Aging Together is recording this program, and it will be posted up on our website hopefully soon. And that's, I was thinking we could maybe share our website at some point, Ellen, to show everybody how they can go and see where our recorded programs are and see what's upcoming. And maybe we can do that. But there's also another question. Thank you, Dora. Someone else let's see, okay. Boy, a lot came in all of a sudden. Oh,
Could
someone
you
says I
possibly
have to.
send that that link to people that signed up for the presentation for the recording?
Ellen, do you think, is that something we can do?
We will
Try to do
try
it.
to do that, and we will want to double check with David that it's okay for us to do that.
Right,
Yeah,
right.
yeah, that is a concern.
So we'll figure all that out, post the workshop here, and we
Yeah.
will definitely get back to everybody. Yeah.
And this would be on the Aging Together website, correct?
agingtogether.org.
So there's a
Okay.
question here. I help to care for my
Yeah.
currently self-sufficient parents, but I do notice that my dad gets overwhelmed at times. I offered to have someone go in to help with my mom and to clean, but my mom doesn't want that. How can I best handle this
Mhm.
situation? David, any thoughts there, or anybody?
Well, those are usually, so someone's worried that if you let somebody else in the house to clean, they're going to steal something from you. It's not that they oppose you actually coming in and cleaning, because that's a nice service that most people would like to have their whole life, to have someone come in and clean their house. So trying to get at the real concern as to why she wouldn't want somebody to come in and help her out, because that's a luxury to have someone come in and clean your house. So
Mhm.
Yeah, it's a good point. It's sort of getting to the root of what the resistance is about, I
Right.
think can be really helpful. That's a great point, David. Thank you. Any other comments, or, I think another really key takeaway from this presentation, kind of what Dora was saying, just to reiterate, Dora, I think you make a great point as well. It's just that the importance of coordinating that team. And I think another part of that with families is there's, especially with 9 people, Dora, I'm sure you must have seen this. My husband's one of 6, and we've seen this with his family. There's always going to be 1 or 2 that are not going to really be able to lift their weight for whatever reasons. And you're not going to change that person, right? That person's never going to change. So it's kind of like going back to what David's presentation was saying, focus on the strengths that people have and on the team. I just think that's a really good point. And I think part of that is also recognizing that not everyone's going to lift their weight in the same way. People are just able to do what they can do. And we have to kind of be okay with that too.
And you also, what I found out when we went through this ordeal, you really have to know what you really need to do. And if they're in a hospital or some facility, what does that facility expect you to do? With my brother being in the hospital, the doctor did not want 9 people calling them all day long.
Right.
They don't want 9 people coming and asking questions. We had to have one of our siblings, just one, that the doctor was in constant contact with about his condition. And they would not talk to anyone else, only that one person.
Good point.
And we had to filter the information from him to the other 7 or 8 of us.
Oh my goodness. Yes.
Yeah.
The spokesperson.
Yes. And he did a wonderful job. I mean, every time he got a report, he texted everyone. But it's a major task when it's 9 people and you're trying to coordinate.
Oh boy. Yes,
all
indeed.
of that. Yeah.
Is he doing well? I hope your brother
is doing well. He was in a coma, a semi-coma, for about 2 weeks. And honestly, all of a sudden, he came out of that. He was sitting up on the bed and he went home a week and a half later.
Goodness.
Oh my goodness. Oh,
So
I'm so glad to hear he's doing better and he's home.
He is doing well. He is still under care, for other things that's going on, but he's doing well. Thanks for asking.
Good. Oh, a nice slide at the end. David, that was really great. Thank you so
Yes.
much.
Yeah, thank you. And I
Thank
think any other questions for David, or comments or stories to share?
Thank you, Mr. David. That was really good. I think that's very beneficial.
My pleasure.
Great.
Well-
And Ellen, do you mind if you share with me? And then I'd love to put our website up just to show everyone before they go.
Sure.
If I can figure it out, I'll try.
Sharing views will
What's
come.
that?
There you go.
Oh, is it there?
You
It's ready?
should be,
Well, you all keep talking while I look
oh,
around.
you know what? I see there's
Uh-huh.
another question.
Okay.
Sorry, I didn't see this. I apologize. One of the toughest conversations may be when a caregiver has to let the loved one know that they should not drive.
Mm.
That's a really good
Mhm.
point. I know in my experience with the Alzheimer's Association for many years, one of the things we used to tell people was to go through the doctor and let the doctor be the bad guy. Sometimes the doctor will write a prescription
Mm.
and say, you know, no more driving, and it comes from the doctor. But if other people have any other suggestions for how to approach that, we can open it up. I don't know, David, if you have any thoughts about that, or anybody else.
I really don't have a good answer here, because I've run into that on more than one occasion, that you feel like you're less than a person when because you're giving up control of your life to something else. It's a loss of freedom, and that's,
Yeah, it's tough, very tough. Yeah.
Okay, here we go. Let's see if this works. Can you see that?
yes.
Okay, so this is www.agingtogether.org. Aging Together covers 5 counties here, including Culpeper, Madison, Orange County, Fauquier County, and Rappahannock County. And first and most important is we have this wonderful resource list that is all these 5 counties. Oh, I haven't been on in a while. There's been changes. That's funny. Because
Yeah, go back to the home page, and I think you can scroll all the way
Here,
down
oh,
for the
yeah.
resource guide.
Right. So
All
I
the-
think
no,
it
keep going
says-
down. Keep going
Oh,
down.
okay.
Yeah.
Oh,
Keep
that's the
going.
big.
Keep going. Nope, keep going down. I think it's down there. Yep, you missed it.
Oh.
There it is, right there.
Here, right here, right here. Yes. Okay. So resource guide. Just to let you see, AARP is at the top of our resource list. Here, let me move everybody's faces around. It's just so you can see we have all different topics too. And then there is a caregiving section. Here we go. And we've got helpful websites and local phone numbers, or 800. We might add some of those 800 numbers that David gave to us, but that's just our resource. Okay, so let's see. And then I wanted to just show you that if you go to, that's our home page is here. Over here are all of our tabs. So if you go to programs, this will show you upcoming programs, and that's where you can register. You can go right down. Here's one that's powerful tools for caregivers. It's going to be hopefully, well, it's actually, this one's over, but there's one coming up in March at the Culpeper Baptist Church, and we're going to try to do it in person. Here's the one for today, but see, you can register right there. Another one we have next week is a Veterans Benefits Summit, so people can register there under the program tab. And then if you go to recorded webinars, that's where we try to post up anything. This was one we did for the holidays about the blues and keeping yourself in good health. And we've got, which one was this, Ellen? We did activities for older adults back in September. And these are all recorded. Here's one on scams. That's with our local Orange Sheriff's Department. We've got Cornerstone Cares videos that they have given to us to post. So you can go back there and look at all of these and watch them there. That's under our recorded programs. And then we have support groups too. So there's a lot of different information. If you need to find local support groups, we'll put the information up for you to go find.
That reminds me, Lisa, are you still on with us?
Yes.
Do you want to talk about just let people know about the new support group that's
Oh,
available?
great idea.
Yeah.
We have a new Alzheimer's caregiver support group that's going to start on March the 11th. And it's going to be from 10 to 11:30. And it'll be the second and fourth Thursdays of each month. And it's the kind of support group that if you can't make one of the Thursdays, don't worry about it. Just hop back on the next Thursday. It'd be that type of thing where there'll just be open conversation. And certainly we'll have some topics we'll be talking about, but it's really geared towards what caregivers need, the information that they need, and the support that they need for caring for someone with Alzheimer's. And we have a great speaker, a great facilitator. Her name is Danielle Lee Powell. And she's going to be our facilitator, and she's going to be leading that group for us. So second and fourth Thursdays of each month, starting on March the 11th from 10 to 11:30.
And I think this is a brand new flyer, and I don't believe that this is actually up on our website yet. So that's why I pulled it up for you if you want to see
Great.
it.
Yeah.
Yeah.
It'll be up very soon. Yeah. Thank you. And thanks for
Okay.
doing that, Lisa. There's such a big need for that in our area. We appreciate that. Well, last chance for final comments or thoughts before we close today.
Let me give you an unrelated tip, if I may.
Yes, please do.
If you're not familiar with how to do a print screen, you really need to know how to do this. This will, anything that appears on the screen of your computer, you can take a picture of, and it automatically goes to the pictures on your computer, wherever you store your pictures.
What about that? You're right.
So to do that, to do a print screen of what's on the screen of your computer, if you hold down the little Windows button, usually in the bottom row of your keyboard, you'll see a little Windows button there next to the Alt.
Hmm.
And then at the very top, you'll see a thing that says print screen, which is, it's a button at the top that says print screen.
Oh, yeah.
Huh.
So you hold the Windows button down and you press the print screen, and you'll see a little flash on your window on your laptop. That means you've successfully taken the picture.
Oh. So it sort of downloads, and if you go to find it, it'll be back over and download.
And then when you're done, just go look at the pictures on your computer, and sometimes it makes a file up that'll say print screens, or you'll just see it there when your pictures. So if you're watching something on your computer and there's a lot of information that you want really quick, just take a quick print screen of it, and you can look it later. So again, you're holding down the little Windows button at the bottom,
Right.
pressing, just give a press at the print screen at the top, and then whatever's on your screen of the computer, it takes a picture.
It blinks. I
Yeah.
just tried. Okay.
And it does that blink. Now later go to your pictures, and you'll be able to see what was there on the screen.
Well, see, we learn something new every day.
Thank you. Thank you. Very nice.
Thank you. Well, thank you so much, David. That was really very, very, very helpful, very informational, really good practical information. Hopefully everybody will download or get that caregiver guide. It looks like a fantastic resource. Thanks for everybody for joining today. Stay warm, stay dry, stay with power, hopefully.
Fingers.
Fingers crossed.
Right.
And we hope to see you all soon. So thanks so much.
Good
All
to
right.
see everyone. Thanks. Bye-bye. Take care.
Bye. Thank you.